The 2018 Pinnacle Award for Individual Career Achievement goes to Lisa Tonrey, Pharmacist and Technical Advisor for the Office of U.S. Foreign Disaster Assistance. For the past 38 years, Lisa Tonrey has dedicated herself to assisting underserved and vulnerable communities as a clinical pharmacist, health administrator, and public health advisor. For the first 2 decades of her career, she served as a commissioned officer in the U.S. Public Health Service, including as a pharmacist practitioner in the Indian Health Service.
I guess I never really worked in an environment where pharmacists couldn't do things, because when you're in an austere environment, everybody really has to work collaboratively to help get the mission done. It was always, what could we bring to the table? How then could we operationalize this so that other pharmacists could do it?
Captain Tonrey improved the medication use process by striving to have all pharmacists immunize patients.
Back in the early 90s, because I was in the Indian Health Service, because I had provider status, because I was a clinician, I was a big proponent of pharmacists immunizing.
She ramped up her immunization initiative in 2003-2004, mentioning it in her very first speech as APHA's incoming president, and in articles she wrote in trade publications.
Fast forward 20 years later, and here we are, all 50 states immunized, and not only are we all immunizing in flu, we actually can now immunize in other areas.
Captain Tonrey brought her proactive, hands-on approach not only to individual patients, but to entire communities and beyond, winning as 2016 Next Generation Pharmacist of the Year.
I think that that's pretty much how I've always looked at things, is not only have I been a patient care advocate, but also a population health management supporter, because it's not just I have one patient, we have a whole population of patients that need these services.
She continues to lead the way for pharmacists to take on an even bigger role within communities.
The future of pharmacy practice, I have to say, I think there's going to be a renaissance of community pharmacy. So I just see that pharmacists, particularly in communities, really can drive or be a solution for deliverable services that individual people need, but collectively as a population, the population needs.